My name is Trenor Williams. I'm a family practice doc by training, and actually, as Ted's going to talk about Kaiser, I actually did my residency out in Southern California. Kaiser practiced as a medical director at a ski resort, and for some reason left that about 6.5 years ago to do consulting with healthcare organizations, both government and private sector. And now for the last 6.5 years have done that mostly with community health and hospital systems. Certainly with ARA, there is a lot of push, and every organization is scrambling right now, and actually they're all waiting to hear the output of today's ONC meeting and what meaningful use is and what the scope of their projects need to be. Many of these organizations, and I'm going to do really a case study about one, are geographically distributed. So as we look at Bon Secours is a Catholic health system. They're based right outside of Baltimore, but they have hospitals from New York down to South Carolina, 14 hospitals. They decided on an initiative to implement one integrated electronic medical record called EPIC, same one actually that Kaiser uses, Group Health uses, for their hospitals, for their ambulatory clinics, for their revenue cycle side, so for everybody there. They have about 8,000 physicians that practice in their 14 hospitals or in their clinics. They only employ 500 of them, which means at any one time those 7,500 can walk. They split many times, so they use other facilities. They don't have a contractual relationship. They have a credentialing relationship with them. They don't have a contractual. So their leverage points and their ability to communicate, they don't have standard emails with these docs. And this is the case for most hospital systems in the country. Hospitals don't employ most of their docs. So they have to start to get creative at how you communicate with them. So when they started this project a couple of years ago, and what I'm going to talk about a lot is how they used clinical content. And what I mean by that is order sets or groups of orders for a diagnosis or a procedure that ideally have embedded evidence-based practices. So the latest and greatest of evidence is part of those orders. And they wanted to build standardized evidence-based order set. So for each diagnosis and for each procedure, build one order set that all practitioners in the organization would use. And they actually had the goal of doing this with electronically, so as they rolled out their electronic medical record, EPIC, they wanted to have the docs use those order sets, but they also wanted the docs before the EMR got to them, because it's a multi-year process, to be able to use these standardized order sets on paper, and we're going to look a little bit at that. So again, the process was EPIC as just the start, really an EMR as a tool. Then how does an organization like Bon Secours, they name it, they brand it, and they create it, and they really, again, using this tool, how do they transform the way that they deliver care? I saw actually a tweet during this from Stephen Tucker, who's a doc, and I believe he said, and I think I saw him here, he's actually in Singapore right now watching, so props to you, Dr. Tucker, was asking, how many docs actually don't use evidence-based practice? That was, somebody had mentioned this in an earlier panel, and unfortunately it's a higher number than we would like. So as order sets or groups of orders get developed, there rarely or unfortunately isn't a process to review those on a regular basis, to embed new evidence as it comes. And so a group or an individual may have developed an order set 3 or 4 years ago and not have touched it, and people might use it or might not. And so the use of evidence-based practice unfortunately is not as consistent as we would like. So Bon Secours, and we helped figure out how to use content to drive engagement. And this is where we got into some social media tools, and it wasn't through Twitter or Facebook at the time, but it was really through using content blogs, internal blogs, about how to share content. We started with individual small teams with representatives from each of their 6 health systems that were part of the 14 hospitals or part of the 6 systems, and had a doc per specialty, and actually did the initial evidence work and used a third-party content vendor called Zinx that embeds evidence and reviews it on a regular basis. We then pushed out that evidence in those order sets to all the docs within the entire organization in that specialty. So for example, there may be 350 cardiologists that practice in 14 hospitals for them. And we pushed out those order sets and elicited their comments on that content before it was finalized. So really wanted to value their opinions and their work in that process. So tell us what you think. And as you guys might imagine, not all of those contents were great. Some were telling us that, A, we do things differently here, wherever here might be. What you're talking about is too complex, or no, this isn't right. But it started the dialogue, and that was really one of the important pieces around and why we thought the social media tools and the blog was important to start that dialogue. We then opened up those order sets to all specialties. So we have about 35 different specialties that practice at their hospital. So allowed and asked for comments from 8,000. The reality is that nowhere near that number actually participate in the process, but it's, again, using lots of different tools as Lygia talked about, and the blog and that content blog was part of it. So again, we pushed it out through Zincs initially to these 8,000 docs. They were able to asynchronously log in. We could send an email with one link directly into an order set. They could log in, provide comments. They're able to see it, again, just like any other blog, able to see other comments around that order set, see what's going on with what their colleagues thought, and provide their own. We then used that process as an engagement tool, and the core team reviewed all of those. But what we found was that was difficult sort of at the point of care, so we actually developed outside of Bon Secours initially, but for their IS department, developed a content website, just using actually WordPress and script, have actionable PDF order sets, and this is what they're using now, so that they're able to go in, and it's actually for COPD is the order set right there. And this is live. All their practitioners can log in, can download the order set while they're in the hospital, while they're on the floor, can use it. But also while they're there, the running stream of comments from their practitioners, from us as leadership folks as we're pushing things out. There's new evidence piece, that it's a continual conversation with them. We've also instituted this as a way to do continual development. So as new evidence is found, is determined, is researched, we can work on embedding that and then using that as a communication tool. So our goals were, and continue to be with all of these health systems, with the docs, how do you go from uninformed to knowledgeable? And how do you go from being isolated to participatory? How do you go from uninterested to engaged? Just to give you an example, and we think that part of the work that we did helped to lead to this, but their first two hospitals went live with Epic in February, and within the first week, we're already at 75% of the physicians were using order entry. So 75% of all the orders within the first week, which is way surpasses national averages. We think a lot of that has to do with engagement, that they were comfortable and part of the process in developing those comments. And again, now those practitioners from all other 14 hospitals are using that content. So really, to Lygia's point as well, we ended up using and continue to use traditional methods around newsletters, departmental meetings, used their website, internal websites, but used content blogs, and Osmosis is one of the newer tools that we're using, not just there, but we're actually using at Valley Health, which is a hospital system close by here in Winchester, to build and develop specialty-based group, not just to talk just about content, but to talk about their implementation of the EHR, their implementation of physician order entry, and really build communities together of all of their specialists. And they're doing some road shows and boot camps. Just contact information up there. Just a couple of other things that I think are interesting, not as much about the EHRs, but AMA just came out, the American Medical News magazine comes out weekly. Just had an article about Twitter and about how individual docs and practices are now using Twitter to communicate with their patient base, really almost using that as an advertising. And as Jason and I were actually there last week, their CMIO was late to the meeting. He's a bariatric surgeon. He was late because he was meeting with hospital officials to talk about Facebook and Twitter because they're now putting Twitter out for their bariatric surgery practice. So we're starting to see more and more uses, not just with the EHRs, but with individual docs and practices.